Innovations are happening across broad spectrum of healthcare, for example, in drugs, devices, delivery of services, physician-patient communication, education, innovation in payments, financing, record keeping, and I would say even in simple things but with a great impact is in patient queue management, payments at the hospitals, diagnostics, or going to the pharmacy, diagnostic procedures, etc. And again, I mean, I can give you a practical example. The AIIMS is a great hospital, but entering that is so difficult. Once you enter inside, again, things are much better than what they look at when you see the huge crowds everywhere, people with worried expressions, people who are tired and waiting from morning till evening for their turn to come. But the doctors are patient, and when the patient goes in, then the quality of care is very good. Health-related information, innovation in that field would be important because the information should reach quickly from patient to, say, emergency room physicians. Up to half an hour can be wasted in emergency for a serious patient. Whereas, if you talk to any cardiologist, they will say that the first hour after heart attack or after pain in the chest is the golden hour because patient recovery is fast. But I have myself seen that in the emergency, where there are so many healthcare givers and emergency experts, it may take more than half an hour often. And the treatment, the much required emergency treatment can get delayed. So if this information is available prior to the patient reaching the emergency, the entire process can be expedited because the physicians, nurses, other healthcare members, they can all communicate by telephone with each other, with emergency, with electronic health records of the patient. Drug treatment will depend on this. And again, if you see the healthcare record, I would rather tell it this way, doctors don't talk to doctors, hospitals don't talk to hospitals. So each time you go to a hospital, it is like going to another island. So island, every time you are asked to repeat your diagnostic tests, and a typical sight in the hospital is patients with a plastic bag of Meena Bazaar or whatever, with at least 4 or 5 kilograms of hard copies of their x-rays and their other records, etc. They try in vain to tell the doctor to have a look at those, but the doctor doesn't look at it. So imagine if all this data is digitized, how much benefit it will be for patient care and also for improving the doctor's communication with the patient and better patient outcomes. Genetic profiling is happening now, and as you know, precision medicine is the buzzword now, where after genome sequencing, we'll know the basis of the disease and which drug will best act in which particular patient. So the movement has already started. It will take some more time. It may even make the treatment more expensive in the beginning, which as it is happening in certain cancers. But ultimately, it will become available and accessed by more and more people. Smartphones are bringing a great revolution. And then another buzzword is 3D printing, which you would be knowing very well. But 3D printing of organic material, the organs of the body. And imagine patients wait for years sometimes for an organ from donor. And if these could be printed, 3D printed. Pill, the first pill has already been approved. It's an epilepsy pill. It is built up by layer. It is more porous. It disintegrates very well, and it will be in use shortly. New healthcare delivery models for high-risk based elderly patients. And believe me, we are still not understanding the problem which we are going to face in this country, because we are not used to elderly patients' care. Our population was very young earlier, but not now. And you can, wherever you go, you can see aging people. In every household, there are aging parents who may be normally aging or sick, and sick with physical disabilities or mental disability, Alzheimer. Some time back it was said that in India Alzheimer is very uncommon. It is not, because it was not being diagnosed. We were not really sensitized towards it. But as my friend Dr. Chandra, who is a Alzheimer expert for WHO, he says, I am seeing this in my clinic. There are lines of people bringing their elderly or not so elderly parents who have got Alzheimer dementia. And these people require special care. These elderly people should not be administered medicines just like that, because even a simple anti-allergic drug can put them into a confusional state for many days. And it will result in more and more diagnostic tests, rushing to the hospitals, admissions in the hospitals, and which are expensive, as you know. A very interesting fact that even I used to pride earlier that, no, I don't like mobile, I don't like laptop. Now, day in and day out, I sleep with the mobile next to me, and my laptop is almost all the time on. But still, if you see some physicians, maybe like baby boomers, they are now going out, they carry pagers. They also carry a phone. These are noisy, inefficient, and a smartphone can do everything. And I am really glad to see this smartphone revolution which is happening in our country, not only in the big cities, also in the smaller areas.